My name is Dr. Sree Kumar. I am one of the consultant ophthalmologists in Sunway Medical Center. What is droopy eyes? Basically, droopy eyes means when both the upper eyelids are covering the center of vision and patient has got some obstruction in the visual acuity. So, what are the symptoms the patient complain of when they have droopy eyes? One, obviously, the patient will say the eyelids look lower, the eye looks smaller, but over time, patient will realize that they'll have a neck ache because constantly lifting the chin up. Some patients, towards the end of the day, they might complain of brow ache because the whole day they need to lift their eyebrows so that they can see better. So, what can we do for droopy eyes or ptosis? One is we need to find out the reason why this patient has got droopy eyes. There are many reasons for droopy eyes. It can be congenital, that means the patient is born with droopy eyes. It can also be due to a previous injury or trauma. They also can develop ptosis. Another reason can be because of a nerve problem. They can have something called as myasthenia gravis, which affects the eyes. That can also cause droopy eyes. In myasthenia that affects the eyes, they also have other symptoms like double vision. They find that they are tired most of the time. So we need to first ascertain what's the reason for the droopy eyes. The commonest reason that we come across in our daily clinical practice is because of a weak muscle. This weak muscle can be because of using contact lens for a very long time. Some patients also have very bad habit of rubbing the eye aggressively. This can cause the muscle to become weak. Well, is there a cure for ptosis or droopy eyes? The good news is yes, there is a cure for droopy eyes. But unfortunately, there's no miracle drops that you can use to cure it. Most of the time, the treatment is through surgery. Depending on how strong or how weak the muscle is, the surgery is customized towards the patient. As I mentioned earlier, in congenital ptosis, that means ptosis from birth, most of the babies are born with very weak muscles. So they need to do a frontalis sling kind of surgery. That means the surgery involves using a stent like a silicone, or sometimes you can even use the patient's own muscle if they're big enough to increase the height of the eyelids. The common surgery that we do is for weak muscles in adults. So in adults, what is the type of surgeries available? Most of the time, the patients come in with very low or droopy eyelids. They don't even have a crease or a double eyelid. So during the surgery, we will find the muscle that is weak, strengthen it through stitches, and make the eyelid higher and match with the other eye. Yeah. So this surgery is usually done under local anesthesia as a daycare surgery. So patient comes in the morning, get the surgery done. So by afternoon, they can go back home. So after surgery, what to expect? Usually they'll have a little bit of swelling and bruising from the surgery. The vision shouldn't be affected. However, there might be a little bit of discomfort for 1 or 2 days. After about 1 week to about 10 days, once the wound has healed, then we remove the stitches. After the stitches are removed, basically they can go back to work. They should be back to normal. Yeah, these are patients who are adults and who have weak levator muscles causing the ptosis. And what to do for children? Like I mentioned earlier, they can do a frontalis sling called a brow lift, which uses something synthetic like a silicone. Or in patients who are older, maybe 6 to 7 years old, we can even use the muscles from their leg to increase the height, which is called a fascial lata surgery. Next thing you need to realize is after surgery, because the eyelid height is higher, they may be prone for dry eyes. So, but the dry eyes usually is temporary because inadequate closure of the eyelid. They need to use some lubricants after the surgery to improve the hydration of the eye. So, in summary, droopy eyes are fairly commonly seen in the eye clinic. They can happen in children, they can happen in adults, but the good news is there is treatment options available. In patients who have weak muscles because of a nerve problem, which we call as an ocular myasthenia, they are most of the time co-managed with our colleagues who are the neurologists. So these patients need to undergo further tests and evaluation by the neurologist, and they can be given treatment based on their findings. So in all patients who have droopy eyes, not to fear, there is treatment options available. So the good thing to do is to seek an opinion from your ophthalmologist who can measure and advise you what to do next with regards to the eyelid surgery. Thank you.